Health Minister's NAFDAC DG, others canvass quality diagnosis for improved health. Nigeria has been advised to pay particular attention to the diagnostic space in order to promote better health, keep the population safe, and provide service to the most vulnerable. The advice was given by former Minister of Health, Professor Isaac Adewale, on Thursday.
In the United States of America, it was established that about 70% of diagnosis made will have to rely on laboratory assessment. In other words, without a lab, 70% of the cases, we can't really go far. In UK, with a population of about 50 million people, 500 million tests are done yearly. And that is like 10 tests per person. And that will go to show that tests are very important when we are offering treatment. These diseases include things like HIV infection, diabetes mellitus, and so on and so forth. We need a lab. Even cancer, we need a lab to make a diagnosis. So the laboratory is so crucial. And I want to thank you, Ma, for considering it top priority to having a first-class laboratory in this establishment.
At the ISO 15189 Laboratory Accreditation Certificate presentation ceremony to access basic medical care diagnostics, the Minister of State, Federal Ministry of Health, Dr. Olorunimbe Mamora, emphasized the importance of competent diagnostic laboratories, adding that the federal government was able to respond to the challenges posed by the COVID-19 pandemic testing and diagnostic through the use of private laboratories.
And celebrate this outstanding achievement by the Public Health Laboratory of Access to Basic Medical Care Foundation. This is indeed an important milestone worthy of celebration, as the ISO 15189 is an award of global standard that recognizes laboratories that have achieved and maintained an outstanding level of quality.
The Director General of the National Agency for Food and Drugs Administration and Control, Professor Christiana Mojisola Adeyeye, in her remarks at the event, said having an ISO certification for a medical laboratory is a result of deliberate embracing of quality culture, adding that the quality and competence requirement is an international standard that specifies quality management system, which was developed by the International Organization for Standardization's Technical Committee.
I would therefore like to congratulate Access to Basic Medical Care for this laudable achievement, having gone through technical training, capacity building, audit exercises, and lots of documentation training from USP, followed by the final assessment from Nigerian National Accreditation System, NINAS. I do not have a doubt that having gone through the training and assessment, investigation reports, and data generated from ABC Laboratory would always follow international standards.
But I am sure he will be smiling down at us, seeing how far we have taken ABC. Biola, you believe in serving humanity, and I promise to keep the flag of service flying. The birth of ABC Foundation was a burden in my heart. The desire to see people enjoy quality health care was my motivation, and that still drives us. Our drive and commitment to provide equitable, accessible, and quality health services for all and sundry in Oyo State and its environs led us to embark on this inspiring journey that has seen us touch lives and make quality health care available and affordable to all.
The laboratory then had the only machine that could do viral screening for patients who are being screened for the virus causing cervical cancer. At that time, the estimate was over 52 to 53 billion, because I did ask Auntie. I said, Your Excellency, how did you come about this? And she said to me, I weep and I express a lot of pain when I see people suffering. And I don't want it to continue. I'm going to leak a secret, but I think she'll forgive me.
USP is a non-profit organization that has been in existence for the past 200 years and set standards for pharmaceutical industry in the US. These standards are now used all over the world. On our part as an organization, we will be on hand to provide support in sustaining the system, and that has been established.